A key part of the yellow fever story is the dedication, commitment, and intellect over many decades that have gone into advancing the science that combats the disease.
The International Health Division of the Rockefeller Foundation has carried on comprehensive and fruitful work in combating the yellow fever.
There's no doubt the biggest advancements were, firstly, the realization that yellow fever is a mosquito-borne disease at the start of the 20th century, and then the development and initial distribution of the yellow fever vaccine in the 1940s.
And now, Dr. Tyler, I ask you to receive the prize from the hands of His Majesty, our gracious King.
Which led to South African Max Tyler working with the Rockefeller Foundation in the United States, being presented with the Nobel Prize in 1951. In the Rockefeller Foundation archive, there sits this fascinating documentary film made with the Colombian government.
Yellow fever especially is again a menace to the islands of the Caribbean Sea and even to the largest cities of the Americas.
Called Jungle Yellow Fever, it shows the rollout of vaccine to yellow fever hotspots in South America in the 1950s.
The Vaccination Commission of a doctor and assistant is equipped to operate independently. A portable kerosene refrigerator is carried, so that during the night ice is made to chill the vaccine the following day. In other containers, the material required to administer the vaccine is packed, while the vaccine itself is carried in a large thermos jug which is filled with ice daily. With such relatively simple organization, commissions have worked in the field for several weeks without contact with the central laboratory.
The film shows health workers traveling by donkey with large, battered suitcases, heading through jungle and mountain terrain, and arriving at a remote village to administer vaccines.
Those persons who are ready are vaccinated rapidly. Alcohol is used for a rapid cleansing of the skin, following which 1/2 cubic centimeter of the diluted vaccine is injected subcutaneously. With each group, the complete details of the vaccination itself are recorded, so that there is a permanent file of all those vaccinated in the country. It is particularly the children who most need the vaccination. Therefore, a special effort is made to reach the schools. All through the day, the line outside the hygiene center forms, but when night falls, all who wish it have been vaccinated. Those returning to distant valleys have been asked to tell others to come the following day, and thus, month by month, the total rises, until today, most of the residents of the danger zones have been protected.
Years later, in 2016, a potentially global yellow fever crisis was narrowly averted in Angola and the Democratic Republic of the Congo. WHO scientists and partners developed an approach that made small amounts of vaccine protect more people by splitting it into smaller, fractionated doses. It meant even depleted stocks of the vaccine could protect 5 times as many people, so the outbreak could be contained.
The experience and our work made me indeed proud. I think it showed that if everybody plays their respective roles, you can actually get an incredible work done.
We tell this very dramatic story in episode 1 of this series. In fact, it's what led to the development of the I strategy, putting measures in place to prevent such a close call from ever happening again. We heard in that first episode from one of the scientists leading on the fractional dosing response, Dr. Joachim Hombach.
It was the willingness of everybody to work together to make this a success. We had technical partners like the CDC available very, very quickly and available to make the resources also available to do the study. And then the scientific community at large that we convened in order to go through this exercise of developing this policy and recommendation in record time.
But what is the innovation that is happening now to help control and minimize mosquito-borne diseases like yellow fever? And what might be available to us in the near future? Because while we've come a long way, a warming climate means a renewed risk of these diseases in new places around the world, and that new reality requires new solutions.
That's the challenge now, because they keep changing with the climate, with adaptation. The warmer temperature favors them, so they keep moving. Aedes mosquitoes, for example, They have expanded to over 150 countries all over the world, including developed countries.
This edition of the Eye on Yellow Fever podcast, episode 7, is called Charting Breakthroughs. The risk of outbreaks of the deadly disease yellow fever is both significant and growing. This is down to a cocktail of contributing factors, including climate change and increasing pressure on land, greater movement of people, particularly into cities, and a resurgence in our highly connected world of the mosquito species that carries and transmits the disease. Yellow fever may not be the most obvious global public health threat, but it's a disease with no cure and a growing risk that must be taken seriously. We are Eliminate Yellow Fever Epidemics, that's I for short. From the world's most senior public health experts to those on the front line of combating this deadly disease wherever it emerges, we have the inside story on yellow fever's expanding global risk. This is Eye on Yellow Fever. I'm Nika Alexander, and our guest today is the WHO's lead on controlling vector-borne diseases like yellow fever.
I'm Raman Velayudhan. I am the unit head for vector control, veterinary public health and environment in the Department of Control of Neglected Tropical Diseases at WHO Geneva.
In simple terms, vector control is the work of learning about, finding, and where possible, removing the threat from disease-carrying insects such as the Aedes aegypti mosquito. It's challenging work, especially as global warming makes ever-increasing areas of the world habitable to the Aedes mosquito.
Basically, I'm an entomologist for any vector control expert, especially controlling urban vectors. Aedes mosquito is really unique. They are very unique in several ways, and they have really colonized more and more countries over the years, and this offers more challenge than ever.
What do we mean? Why do we say vector? It's a very technical term in a way. Why do we say vector and not mosquito or bugs or insects?
The word vector is used to really define that these are insects which transmit a disease from one person to the other. It does a job of a postman or a postperson, as you may call it, really to carry the organism from one person to the other, and that is called a vector in the scientific world.
When I hear vector control, in my brain, I simplify it to mosquito control, but there are other vectors that you think about when you hear vector control.
There are several others. One is, of course, mosquitoes, and they are a large array of mosquitoes, over 400 plus species, or even more than that, which transmit diseases. Apart from that, we have sandflies, very minute insects, which are potentially dangerous in areas where there is a disease called leishmaniasis. Then we have bugs, which transmit diseases like Chagas disease in South America. We also have flies, which also transmit some diseases, specific flies. So there are several groups of insects which are potential to transmit diseases to human. But of course, mosquitoes are the biggest challenge because they account for almost, I would say, 400 to 500,000 deaths annually. And that is a huge number.
So there's the diseases that are carried by the Aedes mosquito, which is chikungunya, dengue, yellow fever, and Zika. But there's also malaria, which is carried by another mosquito. When you focus on mosquitoes, is it quite normal to actually focus on the different mosquitoes? And some people work on Aedes and some people work on the one that transmits malaria. Do you section off the insect world in a way?
Well, we work together right now because we are really trying our very best to integrate our control under this new approach called Global Vector Control Response, which came after the Zika crisis. And yes, in terms of species, there is a distinction between a malaria mosquito and the dengue-causing Aedes mosquito. But otherwise, they are mosquitoes and they bite humans. So these are disease-causing organisms and they are prevalent all across the tropical world.
You mentioned the Global Vector Control Response. What is it that partners, WHO and all our partners, can do? What can these global actors do to control something as small as a mosquito? What's the strategy?
Well, the Global Vector Control Response essentially is to improve vector surveillance. We really need to know what is in your backyard. There are very few places who really know what mosquitoes are there in and around your area or in your locality. That's the challenge now because they keep changing with the climate, with adaptation. The warmer temperature favors them, so they keep moving. Aedes mosquitoes, for example, they have expanded to over 150 countries all over the world, including developed countries. As the weather gets warmer, they are able to go into areas where they have never been before. For example, Aedes mosquitoes are now invading a large section of Europe. Almost 22 European countries have Aedes mosquitoes already there, and they manage to survive the winter by hibernating. Netherlands, Germany, all these countries are at risk. Aedes mosquitoes have proliferated to the most of the central part and southern European countries.
People working in vector control sometimes characterize this in terms of an ongoing battle between science and disease. And just like in any battle, the most important thing is to know your enemy.
Vector surveillance, we use several tools. Most of them are traps. And with these traps, we are able to detect mosquito presence and whether they are around and what is the density and do they have any favorable time period. For example, mosquitoes multiply soon after monsoon season, and what is the density of the mosquitoes. So all these parameters we can measure if we have a suitable device or a trap which helps us to monitor their numbers as well as their presence in and around a certain locality.
What kind of advice does WHO bring? How does WHO help a country to set up a program like that?
We are encouraging countries to establish surveillance program and to evaluate some of these traps which are commercially available. We must admit that there is no trap which is perfect yet. Many studies are in progress and there is a lot of innovative approaches currently in place where we are in a position to even detect mosquitoes with a chip and you get the data on your computer. So the trap is the first important thing which a country has to develop on their own based on their resources. And then we establish a program where we monitor mosquito density over a period of time, at least 3-4 years, because we really need a good baseline data to arrive with a good surveillance picture. At the same time, we can correlate it with any case of arboviral disease reported from the hospital or the laboratory. Once you get that integration, we will be able to detect the hotspot of transmission and immediately do good vector control.
There's more coming up shortly with Dr. Raman Velayudhan, including some exciting new science that uses bacteria in the mosquito's gut to render it harmless when it comes to carrying disease.
By releasing these mosquitoes into the wild population, they go out, they mate with the wild population, and slowly they begin to replace the wild population. Then you see the impact on the disease. There is no more transmission, because the mosquitoes are not in a position to develop the virus within the body.
This is episode 7 of a 10-part series from our I-Team and partnership. To learn more about us and our objectives, see the link in the show notes for this episode in your podcast player, or just search online for Eliminate Yellow Fever Epidemics. And as with all podcasts, if you want to get episodes of Eye on Yellow Fever automatically downloaded to your phone or device, just click subscribe or follow. In this episode, we are sketching out some of the technical and scientific advancements that are giving us new tools in the fight against yellow fever and other vector-borne diseases. One exciting area where work is being done is making yellow fever test results faster and more accurate. There are kits in development that could shorten turnaround time of these tests from 2 days to just a few hours. That's important progress, especially in a fast-moving urban outbreak where every hour counts. Also, anyone who studies vector control and vector management understands that you need organization and communication, as well as science and technology, to combat disease. That's why Dr. Velayudhan, our guest, still with us for this final part of the episode, is pleased to be part of a new global arbovirus strategy from WHO and partners, a joined-up approach that he hopes will foster discovery and progress.
Basically integrating all the arboviral diseases which are Aedes-borne, dengue, chikungunya, Zika and yellow fever, and working together to address them in unison. And this really helps in improving the surveillance system, it reduces the potential for outbreaks, and it also strengthens the capacity of countries. So this is something which we will be launching soon, and we hope that this global arbovirus initiative would be something which helps countries to deal with, in an integrated way, many of the vector-borne diseases.
You said that there are some new tools for vector control. Can you just talk a little bit about those?
WHO has established since 2012, we have established what is called a vector control advisory group, which helps innovators to come and seek advice on new interventions on vector control for any of these diseases, be it malaria, be it dengue, or be it leishmaniasis. Some of the promising ones are the symbiotic bacteria called Wolbachia, which has completed a randomized study in Indonesia and has proved that it can suppress dengue by over 70%. This Wolbachia strain is actually a symbiotic bacteria which lives in the body of the mosquito. It's just a bacteria existing in the body, and it doesn't play much of a role otherwise. But in this particular case, they have taken a Wolbachia from a fruit fly and they've got it into the Aedes mosquito. And interestingly, this particular strain blocks the virus, the dengue virus or chikungunya virus within the body of the mosquito. So the virus does not multiply in the body of the mosquito. So that mosquito is not capable of transmitting the disease. So what we are doing is to infect an area with at least 70 to 80% of Wolbachia harboring mosquitoes. And so by releasing these mosquitoes which have Wolbachia into the wild population, they go out, they mate with the wild population, and slowly they begin to replace the wild population. So over a period of 3 to 4 months, you find that majority of the mosquitoes have Wolbachia in the body. And once they have the Wolbachia and we achieve that threshold of over 70 to 80%, then you see the impact on the disease. There is no more transmission because the mosquitoes are not in a position to develop the virus within the body.
I was lucky enough to be in Brazil and to join a crew from Fiocruz Institute in Brazil as they went door to door looking at how the Wolbachia project was working there. What I found so interesting is there's so much community ownership because you are going into somebody's backyard and you need to get agreement from people in the first place to be part of the study and so on. What have you seen over the years as good practices in involving the community, i.e. the people who are most at risk and who have the most interest in making sure something is done? How do you make sure they are brought on board, and not just to execute what needs to be done, but also to hear from them how the strategy should be rolled out?
Absolutely. I think the community participation is the core to the whole campaign on Wolbachia. Many projects, many studies, we have seen that over 20% of their budget is spent on advocacy and community mobilization. When we talk about community mobilization, we need to make sure that they understand what you are saying. And so we got to get things either translated in their language or it has to be more pictographic. The material is also promoted in schools so children understand exactly what we are doing. They know the life cycle of a mosquito. They are quite interested to make sure that these mosquitoes are safe and are really to control the disease. So this is the approach. We really need to meet the community, apprise them of the activity, and make sure that they understand what we are doing in the most simple way possible. So a lot of effort is done for community sensitization.
And so looking forward as well, what are some other innovations? What are some other approaches? What are you excited about in the next few years of your work and in the next generation that comes afterwards as well? What are you seeing on the horizon that's positive and that will help us in this battle?
Well, I think in the future, we should be in a position to have effective tools, be it Wolbachia based or be it residual spraying or an integration of both. There are several tools in the pipeline. There are few traps which are currently under evaluation to show the public health impact. And there is also a spatial repellent, which currently is finishing their studies for malaria vectors, and they are also extending their studies to dengue vectors as well. So there are several tools in the pipeline. Even in Wolbachia, we have 2 types of them. So it's quite an exciting time. We have several innovations coming through. We should have good tools. It would also be, we have about 2 or 3 vaccine candidates in the pipeline. So that will also offer preventive protection to the part of the population. We also hope that in the near future, we will be in a position to have houses designed in such a way that it can prevent mosquitoes from entering the perimeter of the house. So we can design houses which are mosquito free. So these are areas where we are working. And if the overall control program is established with a programmatic approach with sustained interventions, then we can keep the mosquito population at a very low level. And transmission may not occur when the mosquito population is very, very low.
Dr. Raman Velayudhan, thank you so much for your time today, and thank you for explaining mosquitoes to us.
Thank you very much for having me. Thank you.
Such a fascinating chat with Dr. Raman Velayudhan. Word of mouth is so important when it comes to reaching new audiences with podcasts. So please, if you can, think of someone you know who'd be interested in the Eye on Yellow Fever podcast and send the link to them. You can also select subscribe or follow to make sure that all future episodes of Eye on Yellow Fever are automatically downloaded directly to your device. This episode was produced by Dave Howard with research from Amelia Jansen and sound design by Adam Whaley. I'm Nika Alexander. Eye on Yellow Fever is a Bengo Media production for Eliminate Yellow Fever Epidemics.